Bethany. What I would like to do for the next 10 minutes is to discuss some of the pros and cons to advocating biological language when we talk about mental disorders. Now, before I start, there are two important caveats. Obviously, our brains and biology, as Bethany had said, are implicated in mental disorders, and I'm not remotely denying that. We are our biology, and it's clear that we cannot have mental illness, mental health, or mental anything without a brain. So it is obviously important that we must study the brain. And there's also no doubt that neuroscience is bringing us many exciting discoveries. So nothing in this talk is meant to negate that. Rather, I'm interested in the pros and the cons and the ramifications of the choice to refer to mental disorders as brain disorders, as well as disorders of brain-based chemical imbalances. And so really, coming back to what Bethany said, this is about the social construction of mental illness, how we choose to talk about mental disorders, how that language connects with the actual science, and how language influences how we think about mental disorders. So first, I want to briefly document that the language that I'm talking about is, in fact, common. So just a few quotes here. From Tom Insel, the director of NIMH, within the realm of eating disorders, especially anorexia nervosa, we are talking about brain disorders. From the National Alliance of the Mentally Ill, while the exact cause of bipolar disorder is not known, most scientists believe that bipolar disorder is likely caused by multiple factors that interact with each other to produce a chemical imbalance affecting certain parts of the brain. NAMI again, mental illnesses are biologically based brain disorders. They cannot be overcome through willpower and are not related to a person's character or intelligence. Drug companies, patient leaflet, Seroquel XR corrects a chemical imbalance in the brain. The American Psychiatric Association, schizophrenia is one of the most challenging brain disorders that a mental health professional can face. From PLOS Medicine, a 2008 editor's note, depression is a serious medical illness caused by imbalances in the brain chemicals that regulate mood. And in 2002, Schreiber and Hartick found that nearly all depressed women responding to in a community sample responding to a study had been told by a physician that they had a chemical imbalance in their brain. And this is what I found in a very short round of searching on the internet. So why do I think this is interesting, since this is really something that's getting said a lot? Well, over the past decade, I've found that my students who come to my psychopathology class, and these students are obviously members of our broader culture and also often consumers of mental health services, come increasingly convinced that we as a field have a clear understanding of the biological causes, not the correlates, but the causes of mental illness. For instance, they often believe that depression is caused by a chemical imbalance, and we know exactly what that imbalance is. They increasingly believe that certain structural abnormalities in the brain cause mental illness, and we know what those structures are. And like many, they're convinced that our societal belief that antidepressants work provides convincing proof that mental illness is caused by a chemical imbalance that is treated by those disorders. Yet none of these things is true. So for instance, even defenders of biological models have argued that a chemical imbalance model is outdated, disproven, and likely antiquated. We also have no brain structures or biochemical markers that reliably predict the onset of mental disorders to the degree that we can use them for the diagnosis of mental disorders. And it's unclear whether antidepressants show a clinically significant effect beyond placebo, and even if they do, that finding would not logically mean that their effectiveness tells us something about the cause of the disorder any more than we could say that lack of psychotherapy causes depression or lack of aspirin cause headaches. So I became really interested in this issue because every year it was taking me more effort to unseat my students' opinions about these things that we quote unquote know as a broad culture. In addition, I and others have observed that people seem to have a tendency to mistakenly view that brain correlates of some phenomenon indicate that we've identified a cause. So I'd like to quote a very famous psychologist in our field, Marsha Linehan from the University of Washington. Over and over, correlations of differences in brain structure and functioning with behavioral and emotional disorder is interpreted as providing a causal link. Our scientific knowledge that correlation does not equal causation somehow falls away in this domain of research. And I think our language doesn't help this tendency. So the first obvious question to me is, well, why is this language promoted and what are the benefits of it? And this really comes back to Bethany's point about blame and stigma. We live in a Cartesian society that believes in mind-body dualism, and we believe that the body is more real than the mind. And so one way to reduce blame and stigma is to embed mental disorders very firmly in the body. It also does help sell medications, and that's a less altruistic reason, but I'm going to focus on the stigma reason. And indeed, most research does find that brain disorder language reduces what we would call onset stigma, namely the belief that you are to be blamed for the onset of your disorder. And it also appears to be very comforting language to parents or loved ones of people with mental disorders. And there's no doubt that we need to move away from language that has led parents to be blamed, whether it's for schizophrenia, autism, or anorexia nervosa. So there are some real advantages to this language. Now for the flip side, what are some of the potential negatives? Well, some research suggests that while onset stigma is reduced, offset stigma, or namely the belief that you can get over your disorder and that you have a sense of self-efficacy or agency for recovery, may decrease. So for example, one study found evidence that a brain disorder model led to decreased beliefs about control, greater perceived chronicity and incurability, and a decreased belief that psychotherapy would work, which is really problematic because other research shows that expectancies are a strong predictor of outcome. Another study tested this model, and in the experimental condition, what they did was deceive people who had a history, a self-reported history of depressed mood, into believing that they did, in fact, have a chemical imbalance. And this study actually found no reduction in onset stigma. They found more negative beliefs about chronicity, poor expectancies for regulating depressed mood, and biased credibility and expectancy for treatment. And other research has shown that a brain disorder model may worsen negative attitudes regarding unpredictability, dangerousness, fear, and a desire for increased social distance. And further, even the Surgeon General has noted that while we as a culture have increasingly adopted biological models of mental illness, stigma has not gone down during that same period. We also have problems observed anecdotally. Habit reversal training is a behavioral treatment for Tourette's that substantially reduces tics in a majority of patients. However, according to Vatusic, some patients, families, and physicians oppose the use of this efficacious treatment on the grounds that it undermines recognitions of Tourette's syndrome as a biological disorder. And so that basically means that we're now allowing our models to drive the types of treatments that we're proposing. I and other colleagues in the prevention field have been told by people that prevention of eating disorders is not possible per se because they are biological brain disorders, despite the fact that we know that changing behavior changes the brain and vice versa. And this should be concerning given our discussion last week. And still other eating disorder colleagues have reported patients saying that they gave up trying to get better or seek treatment because they were told their disorders were brain disorders and we have no biological treatments for anorexia nervosa. And finally, I would argue that we need to be careful in how we use biological language because it appears reasonably powerful with respect to impairing people's judgment. So for example, Weisberg and colleagues in 2008 published a study in the Journal of Clinical Neuroscience in which they found that irrelevant neuroscience information made bad explanations more satisfying than they would otherwise judge to be. More generally, they contend, quote unquote, something about neuroscience information may encourage people to believe they have received a scientific explanation when in fact they have not. So what I suggest is that this impaired judgment is something that that could easily come into play in terms of how we talk about disorders. And so in summary, I think we need to have a broader discussion in our culture about whether brain disorder chemical imbalance language is in our collective best interests, or whether there are better ways to go to accurately convey what Bethany mentioned, which is that we clearly know that biology and psychology and social factors are involved in both the onset and continuation of mental disorders. And so I'll stop there.